Our project is called Northford Community Support Services. This presentation was created by Alicia, Kassee, Breanne, McPaul, Savannah, Verkuyl, Emily, Fraser, Katelyn, and Katelyn, Wallace. This presentation will address the recommendation creating and enhancing community supports and alternatives to long-term care placement. Our focus will be on client and family-centered care within an interprofessional model using the full scope of disciplinary practice. During this presentation, we are going to discuss the issue of alternative levels of care, or ALC, which has been a large problem for patients of the Northford Health Center. We will provide a summary of our project, as well as explore the idea of family-centered care, acknowledge our deliverables, and assess the risks for the project. The purpose of this project is to decrease the percentage of patients at the Northford Health Center who are waiting for alternative levels of care or long-term care facilities. We will do this by creating a safe, cost-effective outpatient community service in collaboration with the Northford Health Center for patients who do not necessarily meet all the requirements for long-term care, however still require additional support in meeting their needs for everyday living. ALC is a term that refers to patients who are no longer in the acute phase of their illness, who no longer need the acute services or resources that the hospital is providing, but are currently in an acute hospital bed while waiting for more appropriate or alternate levels of care. Currently, at Northford Health Center, the ALC occupancy rate for non-acute patients is 20%. This means that 28 of Northford's 137 beds are filled with ALC patients waiting to move to long-term care homes. But the issue is also more complicated with the fact that long-term care homes in Sunderland Local Health Integration Network are at 98.9% occupancy, basically meaning that these patients have nowhere to go. Unfortunately for Northford, their funding is directly related to the ALC occupancy rates, meaning that if their ALC occupancy rates remain as high as they are, they will face funding cuts. Living alone is not a feasible option for these patients, as they need some level of daily support in order to remain in their homes. Home care can be very expensive for the healthcare system, as healthcare workers are spread thin across the region. This new project endeavor seeks to bring these patients into one facility where they can receive basic care, social activities, and some medical care if necessary. On average, one day in a hospital costs $1,000. One day in long-term care costs $130, and a day in community care costs only $55. Therefore, it's important and much more cost-effective for these ALC patients to be discharged from the hospital and have somewhere to go where their needs are still being met. In addition, as of 2011, approximately 4,700 patients in Ontario were waiting for an alternate level of care, such as long-term care. ALC patients often wait weeks, months, and sometimes years in acute and post-acute hospitals for transfer to ALC settings. This in turn prevents other patients from accessing hospital beds, increases wait times in emergency departments, and limits hospital surge capacity. Approximately 47% of seniors have completed their hospital treatment but remain in acute care hospitals because they are waiting to be moved to a long-term care facility such as a nursing home, rehab, or home care. There are 20,000 people in Ontario who are waiting for long-term care in the community, and the average wait is 50 days. Furthermore, in 2010, the Ontario Health Quality Council reported that wait times for long-term care beds in Ontario have tripled since 2005. Here is a video that explains what community health is and what exactly community health services can do for the community.
Community health centers offer comprehensive care, so they can treat the whole person. They offer primary medical, dental, prescription, and mental health services. Many health centers also offer pediatric, nutrition, exercise, and other wellness programs. Just as important, health centers strive to deliver services that respect the diverse cultures and needs of their patients. Community health centers are also at the leading edge of technology and use electronic medical records so that all members of the healthcare team can better coordinate and care for their patients. By analyzing all this information, health centers are also able to better manage the needs of patients with chronic health conditions like diabetes, heart disease, or obesity. Dealing with the healthcare system can be an expensive, confusing experience. But community health centers believe in practicing patient-centered healthcare, surrounding you with a team of supportive, caring professionals. And it all starts with you, the patient, taking an active role in improving and managing your health. Health centers responsive to the needs of their patients and to the larger needs of their communities. Community health centers are vital, respected partners in our healthcare system, from providing essential care to communities in need, to treating the whole person, all in one place.
As you can see, a community health service is extremely beneficial to the health of our general population. At the bottom of the slide, there is a link to the full video if you'd like to view it later on.
We are now going to investigate how the Northford Community Support Services can help hospital functioning. When patients are in the hospital and waiting for long-term care homes or designated alternative levels of care, this consumes hospital beds and nursing staff. As the waiting times for beds in long-term care are long, the acute patients are not able to be seen readily. Ultimately, the hospital system and the government is spending more money keeping people in the hospital opposed to discharging them back into the community. The cost of healthcare workers and hospital services is expensive, and having patients who do not need this magnitude of care is not an effective use of services. With the creation of the Northford Community Support Services, some patients who are normally unable to be discharged back into the community due to a lack of support will now be able to do so with the help of our facility. This will allow patients to have independence and increase the feelings of well-being in their home and community. As more patients are needing support and less beds are available for them, there is an increased level of stress among healthcare workers providing care for them. The healthcare workers may feel overstretched, and this may have a negative impact on the care that is being provided to these patients. The money the hospital will be saving through having a community facility to meet the needs of patients who are unable to be discharged without support can be used for other services in the hospital that currently need funding. Overall, we are proposing an outpatient community service called Northford Community Support Services. It will be built attached to the hospital itself. This service is intentionally for patients who do not require the acute services of the hospital, but also present with some functioning independence and so do not require long-term care services, either at a long-term care facility or a nursing home. This service will employ a variety of health professionals, and the patient's plan of care will be established in a sit-down meeting with the patient and their family. This component really stresses a family-centered approach, which is the basis of the service, and we will talk about this approach further on. While patients are receiving care from this service, the healthcare team will always be assessing the patient's needs and level of functioning. They will address the need for the patient to eventually move back into their home completely or into a long-term care facility. Again, the service attempts to be a middle ground between acute care received in the hospital setting, where beds can cost hundreds of dollars a day, or a long-term care home, where again these facilities can be expensive and the wait times are extremely long, possibly years in some cases. Another really important aspect of this service that we are trying to promote is patient independence at all times. We determine what level of functioning they have, and the goal of the healthcare team is to promote this as much as possible while providing additional support in various aspects. Finally, because this is an outpatient service in a fixed building attached to the hospital, the question is, how are patients going to get there? Well, we are going to send an NCSS transportation vehicle to pick them up and drop them off, and this component of the project will be managed by our transportation manager.
This outpatient community service program that we are proposing has, with past research, been linked with short-term and long-term positive effects on patients, families, and the healthcare system. In 2006, Katelyn conducted a study on how an adult day service program significantly improves the quality of life for patients and decreased caregiver strain while also promoting family-centered care. The ADS program staffed multiple healthcare professionals, including nurses, activity specialists, project director, social workers, plus recreational and occupational therapists. Patients received individual care based on a care plan developed by the team in collaboration with the family at admission. Overall, it was found that ADS is a relatively low-cost intervention both for the family and for the hospitals, who are able to discharge alternate level of care patients from highly acute care to a community service. It is linked to a significant reduced cost in comparison to nursing home or long-term facility placement. This program also decreased caregiver strain tremendously and collaborated with the family periodically to review the care plan or any changes to the patient, which helped families understand exactly how their loved one was functioning at these services.
This facility aims to provide family-centered care, looking to meet the needs of the client as well as their support system. A family-centered approach is at the core of this program as it seeks to keep the family together in the home for as long as possible and as long as it is feasible. This project aims to keep ALC patients out of the hospitals and long-term care facilities and allow them to live at home with their support system around them. This program aims to both increase the patient's independence by living in their home and also attending this facility where they are able to participate in activities which can teach them to increase their independence. As well, this program provides an opportunity for the caregivers of the patients to receive a break as they will be able to entrust their loved ones into a place where they can be cared for in a friendly environment. This facility does not provide overnight accommodation, but works to have a program that runs during the day where these patients can come and receive personal care, participate in social activities where they can stay active and mingle with other people in similar situations to them, as well as having a team available to provide medical care if necessary. By having the support service in place, we can create a strong collaboration with the clients and their support systems to provide care that is essential to their physical, emotional, mental, and spiritual, as well as social health. We believe that the Northford Community Support Services will reduce hospital expenses from long patient stays, reduce chances of learned dependence of patients who become accustomed to constant nursing care, and reduce physical activity, decrease the wait time for long-term care by reducing the need for long-term care for individuals who don't need it, increase a sense of community support by offering community opinion through stakeholders and connecting individuals on a community level, and lastly, to reduce caregiver burden of family members who are left responsible to care for individuals before they can move to a long-term care facility. Next in this chart, we have highlighted some obstacles that we may face during this project. This service will have multiple interprofessional team members working together, and at times, especially in the beginning, there may be a lack of role clarification between members as to who is responsible to what task. Our solution to this challenge is to provide employee education and orientation to programs outlining specific duties to each healthcare team member. We will employ a program coordinator as a resource to staff members for role clarification. Next is leadership shortfall. We will employ a project manager to take on the leadership role of this project. Communication breakdown and insufficient team collaboration. To overcome this challenge, we will organize regular weekly team meetings where all members are invited to participate and to promote effective team functioning. This will include managers as well as the staff. Lastly is the lack of user involvement in project stages. To overcome this challenge, we will invite users as well as stakeholders to participate in the early project planning to make sure it is user-friendly for all individuals. In conclusion, our project's purpose is to create a community support program that will address the issue of alternative level of care patients waiting for nursing homes. This program will be beneficial for the community in multiple ways, from increasing the availability of beds for more acutely ill patients, reducing caregiver burden for family members, leading to greater cost efficiency, increased autonomy and independence for patients, reducing wait time for those needing long-term care. This project will lead to all these positive outcomes. From all the reasons stated at the beginning of this presentation, such as the long wait time for long-term care homes and the high number of patients, it is so vital to have this project in place, and we hope that we can see it in our near future. Here is our references that we used throughout the presentation. Thank you for listening, and we hope you consider our project in the future. Thanks.